It has been 1 year since we began our response to this pandemic. In fact, on March the 9th, Ulster County reported its first COVID-19 case. You may recall that was an Ulster resident who actually was participating in a training program here in Dutchess County, and I still remember the call on Sunday morning from Ulster County Executive Pat Ryan that began for us, although the world over had already seen its lives turned upside down. But for us began what has now been 12 months of upheaval, 12 months of change, 12 months of tragedy, and real challenge for all of us. On March the 12th, of course, Dutchess County confirmed its first case. And then on March the 13th, we declared a state of emergency. And then in conjunction with Orange and Ulster County, we issued orders to close schools and to restrict certain activities. And then on March the 18th, Dutchess County and we began our first town hall meeting. Today is our 60th. For 60 separate occasions, we've gotten together to talk through the data, understand the facts, and share what we knew, answer what questions we could, and provide you some guidance. And I hope these last 12 months, to some degree, a little bit of calm, a little bit of comfort, and I think you have seen as a community for these last 12 months, we have risen to the occasion. Over these 12 months, we worked through Dutchess Responds to assist countless individuals. We opened our hotline and began the process of managing responses and bringing food and meals to residents all across Dutchess County who needed it. I can tell you that over the course of these last 12 months, we have seen so very much, and of course, in many ways, together, we've responded to it. I know that there are those who wish this had come to an end sooner. I know that many of our friends and neighbors want it over now. But let's just remember that since March of last year, there have been thousands upon thousands of people impacted by this virus. Hundreds have lost their lives here in Dutchess County, hundreds of thousands across the country. And there are families who were separated from loved ones in nursing homes, in residences for those with developmental and intellectual disabilities. Many haven't returned to their place of work or their office. Some, like those who work in the health department here and throughout governments like ours, haven't left their offices. I know that, like my wife, many families have had to come up with ways to keep their children active and involved, have had to manage work, loss of daycare, and remote learning. And certainly there has been extremely difficult challenges for small business owners who poured their heart and souls into their businesses only to have those dreams dashed. Many digging deep into their pockets to keep people employed, even if they didn't have customers, keep their lights on, even when they were forced to be closed. And some have been shuttered forever. There are families that have suffered immeasurable loss with loved ones that will never return, many of whom never got those last few minutes or moments together when their family member passed. I know I understand the real human toll of this virus, but I don't think any of us can really appreciate the challenge that any other has had to face, and we've all had to navigate this together. So as we acknowledge 12 months of being right here with you, responding to community needs, I also want to say that I am still very optimistic. I believe that now that vaccines are more accessible, and we'll talk a little bit about that today, as more and more have access to a vaccine, as more and more individuals have recovered from the virus, and as we've learned more about COVID-19, that very soon it's going to be in our rearview mirror, and very soon we're going to be back up on our feet in a more normal, or at least a more traditional and recognizable way. As we look forward, I do think that we ought to be optimistic about the opportunities that lie ahead of us. We have a lot of work to do, and we're committed to doing it. And we'll talk a little bit about that. In fact, on Tuesday next week, I'll be releasing our State of the County address. But I do want to say this from the bottom of my heart. I know that when it comes to elected officials, it is easy to complain about them. I know that we always disagree. I know that I will have always made some misstep. But what I can tell you genuinely is I am grateful to the people of Dutchess County. I am thankful for those who have had the patience and perseverance. I am grateful for those who have agitated and irritated us to do things differently. I am grateful to the people who ask the easy questions and the pointed questions. I am grateful to the people who went off to work every single day, not skipping a beat, both in government and in the private sector, to help us in our moment of need. I am grateful to men and women who have had to suffer greater losses than I have. I'm grateful that somehow each and every one of you have summoned the courage, the compassion, and the strength to carry on. And I am grateful that as a community, I think in many ways we have set an example as to at least how to treat one another. There have been moments, where I know that we could have rattled apart, and I know that we have argued and had significant disagreements. But we've all experienced them in some ways together, either virtually or in person, either on television or on through the internet. We have experienced these last 12 months together, and I think as a community have risen to the occasion. We have a lot to still do. I want to get through a lot of information today, but I mostly, on behalf of the government of Dutchess County, on behalf of the people who work in Dutchess County, extend to all of our residents our appreciation for, even in moments where it didn't seem you had it, you did, your patience, your compassion, and your decency. And for that, I'm extremely grateful. I also want to thank the men and women in county government who have and continue in service, whether it's an emergency response or public health or any one of the county government departments. They have had staff and supervisors have all had to find new ways to serve residents, have had to do it under some very trying circumstances, and we're grateful for them. We're grateful for those who continue to work every day to respond to this crisis, to bring vaccines to those who need them, to provide answers to folks who have questions. And I extend our appreciation to Dutchess County's dedicated staff, to our supervisors and mayors, and those who serve in elected office throughout Dutchess County. We've worked as one. There are times that we could have found ways to not agree. We could have simply put our party politics ahead of anything else. But I can tell you that supervisors, mayors, legislators, town board members, city council members, village trustees all worked and have been working together. And that is a remarkable thing and worth celebrating. And I want to thank the volunteers, folks who have volunteered either service, time, or resource to not-for-profit agencies and to the county government to provide assistance when it's needed the most. I do believe that this community has provided a shining example of really what it means to be good citizens. And these last 12 months have defined who we are and how we expect to live. So for and to all of you, thank you.